Gentlemen, my business partner WSU and I appreciate the opportunity to share our business plan with you today. We hope to convince you that partnering with WardAldama Consulting is a sound business investment. We will provide a hard copy of the full business plan at the end of this presentation for your review. Our intent today is to explain an unresolved problem in the healthcare industry and how we feel WardAldama Consulting is the most advantageous solution in an industry that is just waiting for this niche marketing consulting firm. Have you given much thought to your laboratory results? Did you know that 70% of patient care decisions are based on these laboratory results? How do you know that your laboratory results are accurate? Are you willing to bet your life and your physician's treatment on inaccurate results? Does anybody inspect laboratories like they do restaurants or military troops? The answer is yes. The level of detail in a hospital and laboratory inspection is significant, and the checklist for each area of focus includes hundreds of audit questions. The background in this slide is just a sampling of the checklist required during an inspection from the College of American Pathologists, the leading government-authorized inspection accrediting agency. We have observed that clinical laboratories tend to be unprepared for the required biannual inspections and prepare nervously as an inspection approaches. I had the opportunity to randomly poll laboratory personnel on how they feel about preparing for inspections. Although they appreciate the opportunity to share best practices and ideas with their peers, the predominant response besides the rolling of eyes included, "It makes me nervous. It is stressful. It scares me. It is time-consuming and nerve-wracking." Our experience is that laboratories routinely cram for inspections, spending overtime efforts and loss of productivity to be ready. The outcome of these inspections is an indication of the quality of the testing performed in the laboratory. A poorly executed inspection can result in a loss of productivity, as laboratories spend hours preparing for inspections and explaining and correcting those deficiencies. Poor inspections and accompanying deficiencies reflect unfavorably on the laboratories and the hospital's reputation. If there was a consulting firm that could help a client benchmark deficiencies, improve processes, and reduce preparation time, they would be well received. WardAldama is just such a company. Our value proposition is based on a 20/20 perspective for client improvements. WardAldama Consulting is a niche healthcare consulting firm that will provide subject matter expertise to clinical laboratories in the area of regulatory compliance, inspection readiness, and process improvement, providing outcomes of the caliber the client is proud to share with their peers. This results-proven three-pronged approach includes benchmarking clients' deficiencies in order to focus on those areas necessary to achieve a 20% reduction in the number of deficiencies identified, delivering best practices and implementing identified process improvement opportunities to improve client processes by another 20%. And third, positioning the laboratory for continuous inspection readiness, which will reduce preparation time by 20% from the past 5-year average. This marked improvement in progressive positioning of the laboratory will provide peace of mind and confidence as the client strives for continuous regulatory inspection readiness and excellence in patient care. WardAldama Consulting has a reputation for providing high-quality services and results-proven recommendation. Betsy and I have over 60 years of combined healthcare experience. We are medical technologists with advanced degrees in business. We are industry experts, experienced laboratory directors, and regulatory inspectors. We have been on the receiving end of these inspections, and we can definitely empathize with the client. As regulatory inspectors with over 200 inspections between us, we have access to industry best practices and can easily identify those regulatory areas that cause the greatest concern. We have the expertise to help clients have successful regulatory inspections and derive peace of mind with improved laboratory readiness. Conveniently located in Phoenix, Arizona, with a branch in Milwaukee, Wisconsin, and only 4 hours by air from most client locations, WardAldama Consulting has been in operation on a modified scale since the year 2000. We have built successful partnerships with our clients, resulting in repeat client engagements. Relationships and referral business is key to the long-term success of our business. A list of our key clients and projects is in the appendix of the business plan. The types of offerings include regulatory compliance, mock inspections, remediations, and the accompanying regulatory education. We also perform operations and best practice reviews and special projects. The ability of a consultant to be on site to evaluate the conditions of the client market, share lessons learned, and educate less experienced staff, as well as validate client understandings, are all part of the specialized attention WardAldama is known for. An additional lucrative service is the design and construction of new or remodeled commercial and clinical laboratories. To date, we have completed facilities in New Mexico, Arizona, and California. As part of the process, service equipment improvements are implemented before relocations in order to reduce waste and streamline processes in the new facility. A free newsletter containing current and upcoming regulatory changes is an additional offering used to acquire and to maintain our clients' loyalty. Our target market is hospitals with 150 beds or fewer, physically remote medical facilities, independent commercial or clinical laboratories and facilities, and those not tightly affiliated with a larger integrated healthcare institution. The key differentiator is the institution does not have the available in-house expertise. In conversations with guru industry experts, by personal discussion and survey results, we identified an additional market, that of hospital ancillary service departments such as pharmacy or radiology. They also participate in regulatory inspections and have the same issues with respect to being prepared for inspections and implementing industry best practices. They are a subset of our future market. As of 2011, there were approximately 355,000 recognized businesses in the management consulting industry. This does not include those businesses that are made up of one or two persons that may be realizing revenue as individuals. According to industry research, revenue in this industry in 2011 was $165.5 billion, with a profit of $14.7 billion. As the economy recovers and corporations require management consulting advice again, by 2016, industry revenue is projected to increase excuse me, at an annual rate of 4.2% to $203.6 billion. If we break down the consulting products and services for all of the consulting arenas, process improvement and operational management is the largest segment with 31%. 17% is corporate strategy, and 11% is organizational design. These three segments are classified as important to laboratory excellence and are incorporated in WardAldama's service offerings. While the consulting industry is mature, healthcare science is a rapidly expanding frontier, even as economic and financial pressures reduce profit margin and constrain available corporate funds. The healthcare consulting segment represents 9% of the total consulting services industry, $14.9 billion in revenue, and a profit totaling $1.32 billion. This niche market is the largest subset the niche market is the largest subset and accounts for 85% of the healthcare segment, with an estimated revenue of $12.6 billion and a profit of $1.12 billion. In 2011, there were approximately 9,500 laboratories inspected by CAP and 19,000 joint inspected facilities, which could potentially comprise this niche segment client base. Even if every CAP laboratory was part of a Joint Commission inspected hospital, we have identified the opportunity to provide services to other ancillary departments within the accredited hospital. Based on a market analysis and feasibility study conducted in 2011 by WardAldama, a refined potential market is approximately 3,300 clients every 2 years. Looking forward, additional opportunities to consider are the aging workforce and additional federal regulations. In 2010, the U.S. Census Bureau of Statistics estimated that there were 40.2 million Americans aged 65 or older. By 2020, that number will increase to 54.8 million patients utilizing health care in the Medicare-Medicaid reimbursement process. It has been suggested that inspections be required for all Medicare reimbursement environments. If this recommendation passes, those healthcare facilities currently not participating in some form of regulatory inspections may need to enroll in some and could need consulting support. The aging workforce also includes staff retiring from healthcare. Newer employees will be less qualified to prepare for inspections and implement these best practices. They will need additional training and support. WardAldama could provide that additional support. Of the identified risks, two are most significant. The first is the loss of either of the partners. This is a knowledge-based industry, and the value of the company is based on their expertise and name recognition. Addition of qualified staff as the company grows will mitigate this risk. This was started by the addition of our Milwaukee branch in 2012. Another risk would be if the regulatory industry changed faster than the partners and staff are able to assimilate the information. It is critical for all consulting firms to continue to have a defined continuing education program to stay current with new and upcoming regulations, as well as develop the expertise to meet the client's needs. WardAldama has a defined mandatory continuing education program for all staff. Most of WardAldama's marketing will be done through the website, online marketing and emails and brochures, social media, and client referral. The firm will continue to buy industry keywords from major search engines so that our ads show up anytime a user performs a search. This will continue to direct traffic to the company's website. Participation in panel discussions or as guest speakers at industry conferences will afford us the opportunity to build relationships, share business cards, distribute brochures, and to schedule follow-up appointments. Strategic alliances between WardAldama and industry and specialty consulting firms, partnering at trade show booths, cooperative advertising, and co-sponsoring special events will bring a broader range of expertise to the larger firms, allowing them to compensate for their deficiencies in the key areas of regulatory compliance and laboratory best practices. It will also provide the greater visibility that WardAldama needs to increase our potential client base. A database of email addresses will be maintained by the office staff in order to send quarterly newsletters to clients and to prospective clients. The newsletter, created by the partners, will be a process improvement and regulatory update education tool for clients, as well as a mechanism to increase our visibility. To expand the company, we will be seeking funding from outside investors. We have asked for a grant from the Arizona Women-Owned Small Business Program for $100,000. This is possible as we qualify in the North American Industry Classification System category, in which women-owned small businesses are underrepresented. We are using the grant funds for our startup activities to build the information technology infrastructure, update the website, and enlist the services of capable marketing firms to solidify the branding of WardAldama and generate marketing materials. If this grant does not come through, we have identified alternative grant opportunities and angel investors to acquire the $100,000. We are requesting from you $250,000 in funding. The funds will be used for operating costs with a payback of $500,000 at year 5. The funds will be used as working capital to support visits to potential clients in our expanding marketing efforts. By monitoring our net cash flow, you see that we will be in a good position to return double your money to $500,000 at year 5 and can ensure an annual return on investment of between 14 and 15%. Salaries of the partners and contracted accounting and office staff will also be covered with the investment funds. Net cash flow for the first 5 years is provided. Based on this information, as well as projected sales and ending cash balance, we expect to break even at month 10. We expect to ramp up the business slowly, but also to start receiving repeat business beginning at year 4. The 5-year income statement included in the business plan projects the accumulated net profit to be approximately $1,689,000. After the investor return of the $500,000, the adjusted net profit is $1.189 million. Additional financial information such as startup assumptions, professional service fees, sales projections for the 5 years, staffing budget, and the 5-year income statements are available in the appendix of the business plan. So what is the value to the client? The value is reduced overtime and reduced efficiencies, 20% in each category, improved processes, and improved client peace of mind that they are prepared and are focusing on quality laboratory results. What is the value to you as the investor? Low risk and minimum startup costs as we are a proven entity. The benefits are a positive return on investment and the peace of mind that your investment is in good hands with WardAldama Consulting, experts in our field. Thank you so much for your time today. We are available at this moment to answer any questions you have. When would you like us to schedule our next meeting to discuss the questions you may have from the full business plan?